When you talk about symptoms,
Incidence of asthma and allergies are increasing day by day. Asthma patients in their later age also.
we all know that asthma is quite prevalent in childhood or in pediatric.
Asthma incidence as well as prevalence is increasing as I was told. Obesity and stress is causing more problem.
Isn't asthma like a genetic or a hereditary condition which keeps passing on?
Many people who have asthma, which is hereditary or we call it as atopic asthma, it is usually hereditary.
You're breathing the same air, I'm also breathing the same air. But why only I am getting the asthma and why you are not getting it?
Because of increasing pollution and increasing sensitivity to external allergens.
How can you just say that the patient is having asthma or it's just a normal cough?
It's basically a simple diagnosis to make. Most of these the asthma patients they come with difficulty in breathing and wheezing.
So welcome Dr. Shivalingaswamy. We know that you are like a renowned pulmonologist and a big name for us as well. So thank you so much for coming our show, which is Beyond the Pill, and as I said, where health meets conversation.
Thank you.
So just to brief you, it's a campaign. It's One Life by Mankind Specialities, where we empower our population by giving them right knowledge so that they can make right health choices. And to start with, the topic that we have with us is bronchial asthma. We know that asthma is a very simple respiratory disease, and it's quite manageable as well. But then, still, due to lack of awareness, due to mishandling or underdiagnosis, it becomes a difficult condition.
Yes. Asthma is a disease which is very morbid. It causes a lot of morbidity. It troubles your day-to-day daily activities, and it hardly causes mortality, but it causes a lot of disturbance in your life.
Okay.
Yeah, so this is one of the biggest problem Indians are facing nowadays, and because of increasing population and increasing pollution and increasing sophistication in our lives, these non-communicable diseases like bronchial asthma have become much more common.
That's true. But then, in your practice or in your day-to-day patients that you see, what do you think the prevalence has it gone up now, or is it because of the diagnosis has become better? The in numbers are increasing now.
Yes. So definitely numbers are increasing. The incidence is increasing and even the prevalence is also more because of more aging population and also because of more pollution and because of allergies being prevalent in the population. The incidence of asthma and allergies are increasing day by day. We are seeing asthmas in patients in their later age also. So we call it as late onset bronchial asthma. That is there. So basically, what I want you to understand is asthma is nothing but the allergy manifestations inside the lungs.
Okay.
So the upper airway allergies are called allergic rhinitis. The lower airway allergies we call it as bronchial asthma
Okay.
or allergic bronchitis. So this is someone who is sensitive to external allergens like pollen, dust, house dust mites, and various other allergens. When they are sensitive, when they get exposed to these allergens, there will be an allergic reaction happening in your airways,
Okay.
causing inflammation, causes difficulty in breathing. So this is the main
Mechanism
mechanism
of asthma. Okay.
of how this asthma is there.
We all know that asthma is quite prevalent in childhood or in pediatric. But then, what about the incidence going higher in younger population, even in the population who are not smoking?
Yes. So adult population, your asthma incidence as well as prevalence is increasing as I was told, because obesity and stress is causing more problem. People living in urban areas are also increasing, and increasing pollution is also causing allergies. And also the adulterated food what we are eating will also make your immunity low, which will also sensitize yourself to become
Okay, but then it's not like a genetic or a hereditary condition which keeps passing on.
many people who have asthma, which is hereditary or we call it as atopic asthma, it is usually hereditary. Nowadays, the spontaneous or sporadic asthmas are also increasing because of these environmental factors which I told you.
That is what environmental factor you are breathing the same air. I'm also breathing the same air. But why only I am getting the asthma and why you are not getting it?
It varies. It varies because it based on certain genetic makeup and how your immunity is. So based on that, some people will become sensitive to the allergens, which may lead to bronchial asthma and allergic rhinitis. Some people may not develop.
Okay.
But as I was telling you, because of increasing pollution and increasing sensitivity to external allergens, many people are slowly developing asthma. I'll give you my own example. My parents and in my whole paternal and maternal family, no one had asthma.
Okay.
My I myself don't have any asthma. But my children now, we are living in urban area, they are developing allergic rhinitis symptoms more and more.
Okay.
So I'm seeing, despite there was no genetic predisposition, now my children are developing asthma kind of symptoms or allergic rhinitis symptoms. This is because there's a strong environmental factor which plays this role.
When you talk about symptoms, I mean, asthma symptoms being very vague, I mean, you cannot say if a patient who's coming to you with a symptom of cough, you need to say that the patient is having asthma or it's just a normal cough.
It's basically a simple diagnosis to make. Most of these asthma patients, they come with difficulty in breathing and wheezing, and these symptoms are very variable. Sometimes it will be there, sometimes it will not be there. So there is inter variability, symptom variability will be there, and it is not persistent. And they will have associated rhinitis, running nose, sneezing, and whenever they go to one particular area, for example, garden, where they're sensitive to pollens, they start developing cough and wheeze. So, like there is typical symptoms of thick sputum, wheezing, chest tightness are the most common cardinal symptoms of bronchitis.
What symptoms you started seeing in your children to understand that this could be
Yeah.
asthma?
Yeah, first thing what I'm saying is they are sensitive to external allergens, especially rhinitis. So they start having running nose, nasal blockade, recurrent respiratory infections, and especially when there is change of weather from winter to the summer season, and summer to rainy season. Those change of climates, they'll have more symptoms. So this is the thing. There is seasonal variation of symptoms. In between symptoms, there is normal life, and they will have cough, and they will have wheezing, that
Okay.
and
Okay.
difficulty in breathing and chest tightness. These are the common symptoms which can be easily picked up to diagnose asthma.
How do you screen it? Like,
So anyone who is having these typical symptoms, when they come to us, after clinical examination, if we find that there are some RALs, we call it as, if there are RALs in the lungs, and we do a simple test called spirometry or a pulmonary function test. So basically, we will ask the patients to blow through a spirometer machine, which will give some numbers and graphs, which will tell us how much obstruction is happening in their airways. Why obstruction happens? Because after exposure to allergens, because of the allergic reactions, there will be spasm of the airways, and the inner wall of the airways will become inflamed. So the effective diameter of the airway becomes small. Okay. So they will have difficulty in breathing. The severity of obstruction we can see on a spirometer. We do chest X-ray to rule out other diagnoses like pneumonia or anything else, or a foreign body. And also we do a test called FeNO, that is X-ray nitric oxide, that will give us information whether they have allergic inflammation or not. That the patient has asthma or maybe allergic rhinitis, what kind of reactions do you get? Yeah, usually they don't agree. Initially, they don't agree. They deny the diagnosis. They will say, "I'm absolutely fine. I don't have asthma." I always tell them it is not cancer or not AIDS. It's a very simple disease to have, and it is very easily treatable and very absolutely controllable disease. Though you should also understand it is not a disease which is completely curable. It is absolutely controllable with good lifestyle modifications and some medications. We've seen changes comparatively for the acceptance of asthma or maybe inhalers as compared to past as it was. Because of increasing awareness and good education among people. Definitely, awareness is slowly increasing, and it is our duty to do that, to talk to the patient, sit and counsel them, saying that the stigma of using an inhaler and to having a very bad disease is definitely not there. Use of medications to treat your disease is very important. You should not really stigmatize it. If you want to have a good lung health, good lung development, especially in your children, use of inhalers for an asthmatic is very important and very essential, so that they will have a normal life. And when we talk about adults, I mean, how do you tell them that? And any asthmatic patient, even if it's an adult, even if it is a kid, once diagnosed asthma, has to take inhalers on regular basis or for a long time. So how do you counsel them for this? Yeah, you will have to, yes, especially for children, no? Children will agree, not a problem. But we'll have to counsel the parents who are coming with them, because more than children, the parents are anxious. Okay. So we need to counsel the parents, saying that this is very essential for the normal and good healthy development of the lungs of those children. And use of inhalers on a regular basis without fail, whether the child has symptoms or not, is very essential, because keeping the allergic inflammation to its minimum level in the airways despite exposure to allergens will not only lead to good lung development and also helps them not develop frank asthma later in their future. There is a good chance that 70 to 80% of children will have very less or minimal or even no symptoms in their adulthood if they use the inhalers on a regular basis during their childhood if they have childhood asthma.
So, have you seen any cases where asthma is hampering the daily life activity of an individual?
Yes, it hampers a lot. There's something called DALI. DALI is a disability of daily living. So, what happens whenever a patient is sick because of asthma, he will lose his daily wages because he cannot attend his work. Or if he cannot attend his work, even if he attend his work, he cannot do it properly. It will make his life very miserable because he's not able to breathe properly, he's not able to do his daily routine activities properly. Especially children, they lose their school, and other activities. Many a times they won't be able to play, they won't be able to do physical activities. Many people, because of their asthma, they don't want to go to altitude, they don't want to do some physical activities. So they will lose their productive life. So, and also there is a lot of myths behind someone who is having asthma and not having children. Someone who is having asthma, they don't want to get married.
Yeah.
A lot of things. So basically all this anxiety stuff will be there in everyone. Everything can be easily solved by just sitting with them, holding their hands, and counseling them. Yes.
But then this is the scenario with the asthma patients who are on that stage of the disease. What about the initial phase wherein without the inhalers also asthma can be managed, right?
Yes. Lifestyle modifications in any patient who is diagnosed to have asthma is very important. Very simple things, minimum lifestyle modifications. We have to inform them to avoid allergen exposure. It is the most important thing because allergy exposure only trigger the asthma, allergic inflammation, and trigger the symptoms. So avoiding exposure to allergens is very important. That can be done very simple way. Whenever you are going out of the house, wear an N95 mask that will prevent 95% of all these particles getting exposed, unnecessary bacteria and viruses also, that will prevent you from developing exacerbation. So most of the problem is solved. Someone who is having atopic asthma or nasal allergic symptoms more, every second day or third day, just changing their pillow cover, bedspreads, and bed sheets will prevent them from exposure to these house dust mites, which is very common in India.
Okay.
Just replace them, washing them, and drying them up in the sun and ironing them, especially the pillow cover. Just iron them will kill most of the house dust mites, and it will be allergen free. House dust mite exposure is the highest reason for someone developing asthma. Keeping their room uh, clean and with minimum things so that the dust doesn't sit on that. So keeping minimum things will also help because the dust doesn't sit there, and exposure to dust as an allergen is also reduced. And avoiding cold food. Cold is a very strong stimulant of asthma. Cold beverages, with ice creams or anything which is cold, uh, an asthmatic patient should avoid so that they don't trigger their asthma reactions. Room temperature, warm or hot, they can comfortably consume. So these are a very and regular daily physical activities. Keeping their respiratory muscles strong, swimming also helps. Many people think that by putting the child into the water, the swimming will increase their asthma. It's the other way around. They'll make their respiratory muscles strong, so they'll become all right. So these are the minimum lifestyle modifications which can be done, which will go a long way to prevent someone developing severe asthma.
Getting frequently allergic rhinitis or frequent allergies, can you say that the person can later on develop asthma or should be aware that all these frequent allergies could be triggered as asthma?
Yes. So allergies can be various manifestations. It can be skin allergies. It can be respiratory allergies. Someone has an urticaria. They are at a high risk of developing bronchial asthma.
Okay.
Someone who is having only nasal symptoms like allergic rhinitis more, later in the life they may have bronchial asthma also, and it's vice versa also too. It is one airway, one disease, two extremes. So the mechanism of someone developing an asthma, it is the same, be it upper airway, be it lower airway, is the same. If someone has allergic rhinitis or urticaria, the chance of developing bronchial asthma is there. If they do the right modifications and prompt consultation with the pulmonologist, they will know whether they have asthma or not. These are the figures will solve the problem.
Some patients who are having this or maybe on a very initial stage of asthma still continuing their smoking.
There are many people, despite having asthma, smoke. Smoking has been one thing which has become very prevalent. It is increasing in younger population also. It's difficult to take this bad habit out of the population. It's very difficult. I understand. And especially for asthma patients, their airway inflammation will exponentially increase.
Yes.
Their asthma will worsen very badly, which they don't understand. Very important to counsel them. Avoiding smoking or even avoiding passive smoking is very important for control of asthma.
Doesn't they feel that we have inhalers and we have options and we have therapy available, so that is actually relieving asthma, so that could be.
Why do you want to expose yourself to something bad when you know that you are suffering?
Become dependent on the inhalation therapy. And
Yeah.
then when you talk
So,
about
most important thing is becoming dependent on inhalers is not a bad thing.
correct.
It is a good thing. Smoking, alcohol, and other bad habits are bad thing. If you become dependent on that, your life is going to be miserable throughout. But using inhalers is a good thing. Like every day morning, you get up, you brush, you take bath, you eat your food, you comb your hair, you dress well, you go to your office or school or college. So they're all good habits.
Yes.
Likewise, use of inhalers for an asthmatic is a wonderful habit because it will only improve or promote good lung health
That's right.
and reduce their asthma symptoms. They can lead normal life. In fact, they can go to moon. They can have wonderful life throughout their life just by use of inhalers.
When we talk about the use of inhalers, I mean, and the acceptance is far better now as compared to before. But now the challenge lies in using it. Of the wrong technique, they don't get the result which actually the inhalers provide.
Yes, the right medicine taken in the right technique is very important. It becomes our duty not only to prescribe the medicine, to stand beside them, teach them the inhaler technique, or at least ask our respiratory therapy technician to stand and teach them the proper right technique. And every time they visit our OPD, we make sure that their technique is right and they are not using it in the wrong way.
Okay.
80% of asthma not coming under control is not using the inhaler in a proper technique.
Yes.
And also जैसे वो ठीक हो जाते हैं they don't want to use the inhaler.
Yes.
So this non-adherence to the therapy is one more thing which is causing problems. So adherence, compliance, and right technique. These three things come together. Inhaler usage is very easy, and these inhalers contain only the medications in microgram form,
Correct.
microgram thing, and the dose with despite good inhaler technique, the dose what reaches your airways is not more than 40%. So, and one more important thing that these inhalers in asthma invariably contain corticosteroids because that's the mainstay of treatment. They are inhaled corticosteroids, they are not fully corticosteroids. They act on the surface जैसे कि आप कहीं घाव हो गया उसके ऊपर ऑइंटमेंट लगा रहे हो, लोकली काम करता है, वो ब्लड के अंदर अब्जॉर्ब थोड़ी ना होता है. They act locally, they get destroyed then and there. So the systemic absorption, systemic availability of these inhaled corticosteroids is very, very less to cause any side effects. So this is very safe. Be it pediatric or geriatric age, be it pregnancy, be it lactation, inhalers are very, very safe. Despite using regularly, they will not be any problems.
Patients come into like a Google questions and answers about asthma and inhalers.
Yeah, Google perplexity and a lot of complexity is also there with them. But these platforms will give right information.
That's right.
But it has to come from the right mouth. That's very important. That's why I'm telling that if you have issues, consult the expert rather than consulting Google.
And complaining that my asthma is really not improving. Understand that whether it's because of the wrong technique or it's because of.
We have a checklist. Every time they come, we go through these. Whether your symptoms are there, not there, whether persistent or coming under control, whether they're using the inhaler or not, whether they're using the inhaler in the right technique or not. Despite using the inhalers with the right technique, if the allergy symptoms are not coming down, whether the severity of asthma is more. So we need to step up the treatment or step down the treatment. Despite using high doses of inhaled medications, symptoms are not coming down. We need to rule out other causes and also we evaluate them, we phenotype them, whether they are eosinophil predominant asthmas or neutrophil predominant asthmas. Now, with the availability of good medications like biological therapies, asthma can completely be controlled. In fact, we are looking at asthma remission,
So yes.
like how this
Yes.
rheumatological diseases or cancer diseases, we look at remission with medications. The disease doesn't progress. With the availability of these good medications, which are very specific and no side effects, we are actually looking at asthma remission. So proper technique is what we look into.
Yes.
Proper inhaler, what we look into. We look whether they require these kind of biological therapies or not. So we screen them every time they come. So assess them, we reassess them, we readjust the medication and reassess. This is a cycle.
That's correct. And we don't pay much attention to the respiratory health as we pay to cardiology health. Respiration and lung health is not being taken a lot of importance unless and until the patient is becoming breathless or really having a bad asthma attack. So, what exactly is asthma attack and how can the patient or the surrounding people can help them manage it?
So it is there in everyone's mind that life begins with the heartbeat and ends with the heartbeat.
Correct.
So it also begins with breathing and ends without breathing.
Yes.
So heart and lung, they go together. Both of them have to work if you want to have a normal life. So it's very important that there should be awareness among people that it's not only the heart, very important, and the lung also, because the only organ which is completely exposed to environment, uh, be it air or something, is the your respiratory airway. um, as we all study and as you all tell, your lung surface is almost like a tennis court. It's so broad. The
Yes.
total surface is just folded together, and
Yes.
so surface is so huge, and it gets exposed to air which can contain anything. So anything can go and sit in your airways. Since the surface is very broad, and allergy reactions can happen to many people, we should understand that we have a significant exposure.
Yes.
And many diseases in lung will not immediately come, but when they come, they don't leave you.
That's right.
So, and it will only make your life miserable.
That's
So,
right.
having a good lung health is very important, just like cardiology.
I also want you to give me some brief about asthma attack because there are patients who really get this kind of attacks and they don't know the management of it, and that's why we lose out on the life. Or even the hospital in say tier 2 tier 3 cities doesn't know how to manage a asthma attack efficiently.
Yes.
So that is also leading to a high mortality rate due to asthma.
Exacerbations of asthma, what we call it as, or asthma attack. So even whenever there is increased cough, increased sputum production, increasing wheezing in an asthmatic patient who is otherwise normal, is called an exacerbation of asthma or an asthma attack. Whenever they have these symptoms, when they are using their inhalers on a regular basis, when these things come, we need to see whether what is triggering this exacerbation. In India, infections are very common, which are the most common triggers of asthma exacerbation. Like any viral infection or any bacterial infection in the lungs or in the airways will trigger your asthma exacerbation. And outside this enough pollution, enough PM 2.5 and PM10 exposure, especially who are living, people who are living around industrial area, people who are living in core urban areas where dust exposure is very high, they tend to have a lot of exacerbations. So whenever there is increased cough or increased wheezing or increased and change of climate time, if they have this problem, is where asthma triggers happen. When this happens, they must use their inhaler. Inhalers are of two types. One is the maintainer, one is the reliever. Okay. Nowadays, the medications are such that the same maintainer can be used as an inhaler. Okay. The formoterol and inhaled corticosteroid combinations can be used both as a maintainer as well as reliever. So immediate access to the inhaler is important. As soon as you get an inhaler, immediately use it. It will relieve your symptoms quickly, and then approach the healthcare facility, be it a pulmonologist, be it a physician, any nearby healthcare facility, and you can go and take a nebulization. If your asthma attack is severe, an inhaled corticosteroid or an injectable or oral corticosteroid, and also looking into the trigger, like if it is an infection, treating the infection properly. If it is non-infectious, just treating the exacerbation properly becomes very important. Okay. Formoterol containing inhalers, they act both as maintainers or and relievers. So we call it a smart therapy. Okay. So single maintainer and reliever therapy. If you're having one formoterol containing inhaler, will work both as maintainer, and in between we have exacerbation, it is in reliever. So okay. Exacerbations can be completely controlled by just using the inhaler only, and then treating the cause which has triggered the asthma.
Awareness is increasing just as the incidents are rising and the acceptance of the therapy is also increasing. What do you see as the new advancements that could be happening in the next era, in respiratory health?
Yes. So as I was telling you regarding biological therapy, biological therapy is basically giving specific monoclonal antibody injections to these asthma patients. So let me just put it in a very layman term.
Yes.
Uh, there is an allergic reaction happening, an exposure to allergen, and there is a cascade of reactions happening, and finally there is swelling of the mucosa, running nose, wheezing, all those symptoms come. So when in this cascade of reactions, there are few key steps which will cause the major problem, which will promote the next reaction cycles. So these specific monoclonal antibodies, what we call, they are antidotes to these specific molecules. So there's something called immunoglobulin E in the body,
Okay.
IgE, which is responsible for
Allergy.
increasing allergic reactions in the body. So if there is high levels of IgE in our body, so definitely there is IgE mediated inflammation. You block the IgE, and you don't let that IgE sit on the receptor and cause problem. You block the IgE specifically, so that will reduce the asthma incidence. And also, like IL-4, one more molecule and its receptors, there is something called mepolizumab or benrolizumab. These are all monoclonal antibodies which specifically, and they are produced in human cell lines.
Correct.
So the someone developing allergic reactions is very, very less. There were days where they used to produce these kind of molecules in chick eggs and other things. So there is a risk of developing allergic reactions to their proteins, but these are human cell line produced stuff. So someone developing reactions to them is very, very, even then we observe them. These are given in patients who have got severe asthma, despite use of inhalers in a higher dose, not improving biological therapies all sorted. Okay. For these severe asthma patients, use of biologicals is one thing. 90%, 95% of your problem will be solved only by lifestyle modifications, use of inhaler therapy. These biological therapies are presently reserved for severe asthma patients. Maybe days may come where we can start using them early. That's true. Till then, inhalers are the heroes and should be accepted it that way. Yes. So, thanks a lot for joining us and making the awareness program. I mean, helping us spread the awareness about the asthma. Thank you. So, it was a delight having a conversation with you. Thanks a lot. Thanks a lot for having me here. It was a wonderful talk. And really, you guys are doing a good job creating awareness among public, and making them know what problem they are facing, and having more awareness will help them get their disease under control and have a better quality of life. And thank you for sharing some of the knowledge.
थैंक यू फॉर वॉचिंग आवर वीडियो टिल द एंड। अगर आपको हमारा ये एपिसोड पसंद आया हो तो डोंट फॉरगेट टू सब्सक्राइब टू आवर चैनल एंड फॉलो अस ऑन इंस्टाग्राम। इट्स वन लाइफ बाय मैनकाइंड स्पेशलिटीज, जहां हम बात करते हैं हेल्थ के बारे में। मैं मिलती हूँ आपसे अब नेक्स्ट एपिसोड में। अंटिल देन, स्टे इन्फॉर्म्ड, स्टे हेल्दी।